Whoa, it is Christmas in Washington, and if you want it on healthcare, they will gift wrap it for you on healthcare. So many gifts, so many ornaments, so many lights, so many billions, and all because so little time. Welcome, everybody. I'm Neil Cavuto. Christmas may be months away, but that ain't stopping senators today from trying to outdo each other on healthcare. All sorts of pricey ornaments, or in this case, amendments. Try 564 of them, all being considered as we speak. So what was once an $890 billion bill, and now closing in on $1 trillion. Count Republican Senator Lindsey Graham very concerned. I guess I can't be too surprised, Senator, but the pace of this is startling.
Yeah, this gives making sausage a bad name. It's ridiculous, really. You've got three proposals. The House bill that was jammed through the House without any Republican support. That's about $1 trillion of spending, $289 billion of the deficit. And you have the Baucus bill that literally changes every day. We're making this up as we go, dealing with 1/6 of the economy. Probably not a good way to do business.
All right, now obviously Max Baucus, who was trying to get more and broader support for this, is trying to see what he can do to get broader support for this. But is he giving away the shop in the process?
Well, I think that, one, I applaud him for trying to solve the problem, but here's the problem with his bill. Whether it's $856 billion of new spending or $1 trillion, the way they get to deficit neutrality doesn't make sense to me. The bill will assume that the Congress in the next 10 years will cut Medicare by $400 billion. We haven't cut 40 cents out of Medicare, and it goes to the uninsured, which I don't think is going to go over very well. And it's $300-something billion in taxes at a time we can afford no new taxes, and it adds 11 million people to the Medicaid rolls, and which will hurt states who are already bankrupt. They can't afford the 5% surcharge. So I don't think this bill is going to go anywhere because it's fundamentally flawed. We're not going to do the things to make it deficit neutral, and it has a policy shift to expand Medicaid at a time when it can't afford to be expanded.
All right, so when you're looking at all of these amendments being added here, better than 600 pages of them, we can give you a peek at that, just the sheer thickness of the amendments. That's not just the bill, that's the amendments to it. Presumably then all your colleagues have to go through those amendments, and I guess you're not worth your Senate stripes if you don't have at least one amendment to add, right?
Well, the process of making a bill is complicated, but you got 500-something amendments that will be going through in about, a week? Nobody understands the bill because the ink wasn't dry on the original version until it was substantially changed. There's a lot of pushback about the mandate raising the cost of middle-class Americans. I thought we were supposed to lower health care costs. This bill had the opposite effect. It was a really big surcharge to middle-class Americans, the people we're trying to help. So it's been changed today from yesterday, $28 billion in extra subsidies. They're meeting themselves coming and going.
Well, what I'm worried about, Senator, I understand, sir, but what I'm worried about is on both sides, you get more than you bargained for, and a lot of it that has nothing to do with health care reform. So you'll start throwing in there someone's new highway or someone's new bridge, or you know what I mean? And then all of a sudden this has very little to do with health care, and what can you do for me in my county or district or state? And then the whole thing's kaplooey, right?
Yeah, here's what I think. They're trying to buy votes. That's your point. That's what they did with the cap and trade bill. They started exempting people from the effects of the bill, and they passed it by one vote in the House. They're literally trying to change the formula to get more people on board, but we've lost a vision. The vision for me is to take the existing amount of money we spend on health care, which is more than any place in the world, do some reforms like medical malpractice that will lower cost, empower people to make more purchases in the private sector, not less, and try to find a way to move forward as a country. That means getting in a room, thinking about it over time, where Republicans, Democrats, and the private sector trying to plan a bill around a vision. The vision here is to pass something. They don't give a damn what it is, and nobody understands what they're doing. That's not a good way to change 1/6 of the economy.
So why don't you and some of your more prominent Republican colleagues all get up to a microphone and say, rather than what Democrats are saying about you, that, you just are the party and no, say, all right, here's what we are going to do to counter what we see going on here. Because the rap against you guys is, I'm sure you're aware, Senator, is that, you whine and complain about stuff, but you don't come up with anything on your own.
Well, I would say to the people who say that about me, you're not looking at what I've done. I'm on two bills. Russ Feingold and Lindsey Graham, the right and the left, have come up with a demonstration project, $40 billion, to be given in grants to 5 states to find ways to insure the uninsured with different ideas. One could be a single-payer plan, the other could be a private sector plan, but see what would work in the states, get the data, and make an informed decision. The other bill I'm on, with 7 Republicans and 7 Democrats, is the Wyden-Bennett bill. It is a bipartisan compromise. It requires everyone to be insured. It has no public option. It is deficit neutral. You buy your health care in the private sector. It takes deductions from business over a 3-year period and gives them to individuals so that they can use the tax code to empower individuals to buy health care through the private sector. I am on a bipartisan bill, but the president is dead stuck on this my way or the highway, and nobody seems to be caring much about bipartisanship.
Or the highway. Senator, thank you.
Or the highway.
Very good seeing you
or
again.
The highway.
Thank you very much. All right, now, with the cost of that